Now, the fight against HIV/AIDS has been hailed as one of the most successful public health projects in human history. But teams from the international medical humanitarian organization, Médecins Sans Frontières, or Doctors Without Borders, see the revolution as unfulfilled for millions of people excluded from treatment. Now, last week, a report by the pressure group Stop Stock Outs Project said that at least 1 in every 5 public health facilities have run out of HIV or TB medication. And the project, which consists of Section 27, Médecins Sans Frontières, and the Treatment Action Campaign, said the drug shortages have become a national crisis. We chat now with Dr. Tom Ellman, who's the unit head for South Africa for Doctors Without Borders. He joins us in our Cape Town studio. Doctor, good morning and welcome to the show, first of all.
Good morning, Udo. Hi, thanks for having me.
Good to have you on. Now, since we first heard about AIDS in the late 80s, up until the year 2013, what are we sort of celebrating as the successes globally in the fight against HIV and AIDS?
Yeah, celebrating is a difficult word to use in the context of HIV. There's no question that there have been incredible changes, very welcome changes in access to treatment globally, but it's far too early to start celebrating. Doctors Without Borders is an emergency organization, and we're still working very, very hard with HIV because what we are seeing is an ongoing emergency with millions of people still denied access to treatment.
Now, that will be sort of at the heart of what we are talking about here this morning. I just wonder, as human beings, when we reflect on where we've been able to sort of turn back some of the effects of the pandemic, what would those be?
Well, I mean, the epidemic is turning, and the greatest news of all is that we now know that we have the tools to prevent and to treat HIV. So it is possible to stop HIV. In South Africa, there have been incredible changes. Over the last 10 years, the life expectancy in South Africa has increased by 10 years simply because of the rollout of access to antiretroviral treatment. But there are many people being left behind. So we are not saying that things are not getting better. There's no question that there has been a revolution, but it is unfulfilled.
All right. Now, I want to open up the lines to our listeners as well on 011-883-0702, Cape Town 021-446-0567. That report that I spoke to you about just a while ago says that 1 in every 5 public health facilities have run out of HIV or TB medication. If that is the reality on the ground, there are people listening right now who've been impacted by those shortages. I want to hear from you. I want to hear where those shortages exist, but I also want to hear from all of you the current messaging around HIV and AIDS. Does it hit home to you? Does it speak of the challenges that remain? And we had the health minister on not too long ago where he spoke about testing, men in particular, and also how circumcision can work as some kind of preventative measure. But I want to go back to Cape Town before we go to those calls. Doc, now 20 million people in South Africa have been tested for HIV, and there are still shortages of medicines and antiretrovirals in the health sector. Is this mismanagement of public health facilities, do you think, or a lack of political intent to go with the messaging that government puts out there?
Well, I haven't been working directly myself on the Stop Stock Out campaign, though we're closely engaged with it. And there is no question that over the last 3 months that the survey described, there was a major problem affecting over 400,000 people, where there were stockouts or shortages of essential antiretroviral treatments and TB medications. This varied widely across the country. There were some signs of change, and there are welcome signs that the government is going to respond rapidly to improve this situation. But exactly what causes it is a variety of things. There has been a big rollout. There is no doubt that there is mismanagement in some areas that needs to be improved. There have been changes in terms of the types of treatment that have been rolled out, and there have been shortages associated with that. But it's not good enough. 400,000 people having difficulties accessing their treatment is unacceptable in a country like South Africa.
That is a massive figure. Now, what are the medical consequences if people are sort of being forced to skip their treatments because of a lack of availability?
Well, first of all, it's depressing. Imagine the messages that we tell people is take your treatment and never miss a dose. If you miss a dose, there is a danger that you will get sick again and that you will develop resistance. There is a danger that the virus will multiply in your blood and you will pass it on to your partners and to your children. So it's a very difficult thing for a patient to accept that they have to stop a treatment because the government and the health system has failed to provide them with their treatment. The exact implications of a stockout on patients are both for as long as they stop their treatment, the virus will be able to replicate, and while it replicates, it can develop resistance.
Now, stop stockouts. You brought out those figures. What are you doing to make sure that the situation does indeed change?
Well, we are working hard to spread information about it along with our partners, and I should say that Doctors Without Borders is working with many partners, including TAC, Section 27, and the Southern African Clinician Society on this. So there are many people working, and the real goal is to get the health system and the government to acknowledge the problem and to do their best to resolve it as quickly as possible.
Dr. Tom Ellman from Medicine Sans Frontier. I see some of the calls coming through already, but I do want to speak to you. Those of you who've been impacted directly by the lack of availability of anti-AIDS or antiretrovirals within our public institutions. Talk to me about that. If 1 in 5 public institutions are running out of HIV or TB medication, there must be people who are affected by it, but also the messaging that goes out on the 1st of December and throughout the year around HIV and AIDS. Just how is that hitting home, and what message is it leaving you with today? Bearing in mind that yesterday was World AIDS Day. We'll come back with your calls. We'll continue chatting with Dr. Tom Ellman. Need to take a breather, though.
The John Robbie Show, weekday mornings, 6 to 9.
Patriotic Alliance. This is unbelievable. Only in South Africa can we have a political party founded by criminals. And Gayton McKenzie and Kenny Kunene have founded it. And there's leaders of the 28th gang and the 27s gang. They're all forming a political party. There's the Patriotic Alliance and there's now the Progressive Alliance. And this is the guy, Ivan Waldeck, and he says that he is reformed. I wonder who the General Secretary will be. Maybe Radovan Krejcir?
The John Robbie Show on Talk Radio 702. Your number one news and talk station.
There's some things you want more of. Holidays, the size of your bank balance. And some things you want less of. Your weight. Toll roads. That's why at KTB Cupboards, you can get more kitchen for less. KTB Cupboards cuts the price of your kitchen and bedroom cupboards by up to 50% without cutting the quality. DIY or fully installed. Send the measurements and we'll design your dream kitchen for free. Go to ktbcupboards.co.za or phone 0861 582 000. KTB Cupboards, direct from the factory.
Okay, thanks for your help, Dave. Cheers.
Which Dave was that?
It was Dave, the managing director from Digit Vehicle Tracking, helping me with a fleet management query.
Oh, is he a personal friend of yours?
Well, it sure feels like he is. As each branch is independently owned, you know their names and they know yours. I get the service I deserve and need to take care of my fleet. Digit Vehicle Tracking. We know your name and where your vehicle is.
Iceland, a tranquil destination synonymous with fresh air, the purest water, and rejuvenating hot springs. It's also the home of BioEffect, the world's first skincare product to contain plant-produced EGF, a natural cellular activator that eliminates dry spots, restores natural radiance, and reverses the signs of aging, no matter how old you are. BioEffect, you are just 4 drops away from beautiful skin. Available at Plastical Skincare Clinics, selected Dreamnails beauty salons, and Edgar's.
In the unlikely event of a sudden loss in cabin pressure, the oxygen mask...
Nervous, flyer? Oh, no, work stress. We're building a 10-story office block and the steel fire escape collapsed this morning.
Ah, you obviously didn't use Fisher fixings.
No, we didn't.
Aha. From suspending bridges to hanging pictures, Fisher fixings are the strongest and most reliable. So think very carefully about the fixings you use, then insist on Fisher fixings. Because with Fisher, what goes up won't come down.
Hi, my name's Athena.
Ah, yes, Athena, the Greek goddess of wisdom and civilization, the daughter of Zeus. In fact, she was Zeus's favorite child.
Thank
you've got what it takes to stump him? Get to 702.co.za. Submit your general knowledge questions for the 2014 Brain of 702. You could win a share of 10,000 Rand. And your question will be added to our question bank. Brain of 702 with Dischem. A winning mind in a healthy body. On Talk Radio 702. Your number one news and talk station.
Udo Carelse on Talk Radio 702, your number one news and talk station. Call Udo on 011 883 0702.
19 after 10 it is. We continue our chat with Dr. Tom Ellman, head of Medicine Sans Frontiers South African Medical Unit. He's down in our Cape Town studios. And, Doctor, a number of people want to have a chat with us, so shall we go straight to the lines then, huh? Let's do that. Sharon in Pretoria, good morning.
Good morning, Udo. How are you?
Very well, ma'am. What's on your mind?
I'm fine. You know what? I'm in a predicament here. I've just found out that my cousin is positive. She's apparently taking the ARVs, but secretly so. Mm-hmm. And she has a 10-month-old baby. She recently went into a coma, and that's when I actually found out. So I'm like torn between telling my aunt and keeping her secret. I just need an advice from the doctor. How do I handle this kind of a situation? Because she's also taking some antidepressants, and it's killing me, honestly speaking.
Any advice that you can give Sharon, Doc?
Okay, well, I won't pretend that I have an answer for that. I think it raises a very important point that I would like to talk to, but what I would recommend is that you get in touch locally with the Treatment Action Campaign, and perhaps after the show, Udo, somebody would be able to contact this lady and give them the local contact.
We will definitely connect them, and we'll also put all the important contact details up on our website.
Yes, and then Udo?
Yes, ma'am.
Udo, there was a time where she told the father of the baby, she tried to commit suicide. Because
Sharon?
The guy actually laughed at her.
Okay. You know what we're going to do? Because our conversation right now is a slightly different one. But I'm going to put you back to our producers. And then we're going to put you in touch with people who can assist, yeah?
Okay.
Okay. Slightly more directly with that issue. Let's go to... yes,
Udo, I would like to respond to it. So couple of things. First of all, I'd just like to clarify regarding the stockouts, because I think it's important we get the facts right. This is a very sensitive issue politically and emotionally. What we actually did was tried to phone every single one of the health facilities in the 9 provinces of South Africa that are providing antiretroviral treatment. Of those, over 60% were contacted, which is over 2,000 facilities, and 90% of those responded. So 1 in 5 of those facilities that we got in touch with, which we think is representative of all facilities in the country, was reporting stockouts. And the critical thing now is that people respond to that patients complain if they're not able to access treatment, and that people don't accept that this situation continues. But to come back to the highlighting thing that I would like to bring up generally in this show, which is based on our recent release entitled See What We See, is about highlighting the real problems that we are facing and that patients who we work with are facing in not just South Africa, which frankly is doing much better than many of the countries we work with, such as Democratic Republic of Congo, Guinea, Myanmar in Asia. And to bring out what the real problems are, rather than simply reiterating what a great success story this is. And the lady who just called in highlighted one of the points that we bring up very strongly in the release and in the videos that we have produced, which are accessible on our website. And that is stigma. Stigma is continuing to be a major problem. This lady is in a coma, has not been able to, has been laughed at by her partner because of HIV-related stigma. And that remains a critical barrier, both for patients, for people in their communities to talk about HIV and to get treatment before they get sick, and to take their treatment without having to hide, as this lady was describing, without having to hide the fact that they are taking drugs to keep healthy and to stop themselves from transmitting HIV to their loved ones.
All right. Let's get to Barry in Boksburg. Barry, good morning.
Good morning. Hi, my name is Barry Gray. I've been involved with supplying and helping people develop the HIV test since the 80s. And some very interesting things appear We've supplied HIV tests to the blood transfusion to keep blood safe and stuff like that. It's hugely difficult. We've been very successful in developing all these fancy drugs to assist with HIV, but there's a very useful ethical argument that comes in here, not necessarily my views, which I say. You keep a guy alive for an extra 10 years. If you can't stop his behavior of still having unprotected sex, he spreads the disease for 10 years. If you don't give him treatment, he probably dies in half a year or a year, and he only spreads the disease. So it's a knife-edge situation, and then also the sustainability of being able to treat a never-ending supply of HIV-positive people. I suspect the government has run out of money. That's why there's no more HIV medication available. Because
okay, Barry, let's give the doctor a chance to respond. There are a number of things being raised there by Barry, but Tom?
Okay, Barry, well, thanks for your comment, but I'm afraid I feel that you are wrong in so many ways in the way you've described the problem. The first thing is that you said never-ending. This is not a never-ending epidemic. This epidemic can be stopped. If that man you described is taking treatment, he will not transmit HIV to other people. Other people can take treatment to prevent themselves. They can use condoms, and condom use has risen massively in South Africa as a result of increasing awareness. And fundamentally, the problem of access to treatment at the moment, the drugs prices have dropped fantastically, and they will continue to drop. So I think that while you're right that we have a lot of difficulties in keeping people on treatment, in getting men to take treatment, particularly men, it's true, in changing sexual behavior, incredibly difficult. We can do it, and we have many experiences from our own programs and others around the world that are showing that the tide can be turned and is turning.
You raised a critical issue, and I think people need to see those videos to sort of get under the surface of why there is still stigma. If we look at the South African scenario, what have you learned from our belief systems, our value systems that still has the people with HIV/AIDS stigmatized so much in our country?
I can't answer that question. Your listeners will be able to answer it much better than I, and our first caller immediately highlighted what a problem this is ongoing. We're working, in one of the films that we highlight is in Eshowe in KwaZulu-Natal, where we're looking at how we can increase testing. And certainly the first step in awareness and in accessing treatment is to test and to know your status. And while many people are testing, many people are not, and they are not testing enough. So we're looking at ways to get out into the communities, to involve communities more, along with partners in KwaZulu-Natal and in our projects around the world, including outreach to communities, including new and simpler tests. And hopefully over the next years we're going to be able to roll out access to an oral test where people can simply rub inside their mouths and get a result like that. But the answer to why is stigma a problem is for greater brains than mine.
An SMS question. Cindy in Ferndale wants to know, Udo, why is there a shortage of only 3 TC, but one can get up to 3 months of EFV and tenofovir? I'm hoping I'm pronouncing that the name of that medication correctly. Can you assist Cindy in Ferndale?
Okay, well, it's not correct that there are only shortages of 3TC, so that's lamivudine. It's true that was the most frequently reported drug stocked out at about 23% of the facilities reporting stock out, but we also had significant stockouts, 18.5% of efavirenz, 17% of stavudine, D4T, which, as your listeners will know, is being removed because it causes significant side effects, and also of tenofovir at 6%. So it is affecting all drugs. It's not just lamivudine, but it's true that is the most affected.
Ian in the Joburg CBD, good morning.
Hi, Udo. This is going to be probably very controversial, but related to obviously the treatment of HIV and AIDS. In a world which is rapidly approaching 8 billion people, where we have mass unemployment, shortages of water, food, energy, all of these problems which are directly associated to massive growth in human population over the last 100 years. Are we perhaps not being, and again, this will sound incredibly insensitive to those who are suffering from HIV and AIDS, but are we perhaps not being, the old saying, in our wisdom we have become fools, where we are going to create a problem far bigger than that of HIV and AIDS. If we get to a world that has 8.5 billion people, where quite literally we start to wage war for resources that simply aren't available because there are far too many of them.
All right, yeah, and I get that we're dealing with a multifaceted problem here, but whether we are 10 or 12 billion, the reality in the world is that we are still having to fight HIV and AIDS, that there are treatments available, that behavior needs to change. I don't want to get bogged down in sort of dissident 101 theory around HIV and AIDS, but I think the point made that we need to control our populations, Doc. What I'm more interested in is the kind of messaging that goes out on World AIDS Day. And our health ministry was very specific, saying that they are concerned that in Southern Africa we're seeing more women being transmitted, the transmission rates are higher, and they've also put out the message that men need to take responsibility and get tested. I'm just interested in why the transmission rate amongst women is so high. Is it linked to the fact that men are simply not getting tested?
Yeah, I mean, in terms of infection, women, particularly young women, 16 to 24-year-olds, are often having sexual relations with older men and have a very high risk of contracting HIV from these men, often who will not use condoms, and younger women have great difficulty negotiating condom use. But women are also transmitting HIV to their babies, which is something absolutely preventable, and that's because of the failure to properly roll out access to treatment and access to what we call PMTCT, prevention of mother-to-child transmission. Very simple drugs that can be used to prevent transmission with almost 100% success rate from mothers to their children. And in some of the settings that we're working in Congo, and indeed in parts of Lesotho, where you have where access for women is still around 50% or less, we're seeing great failures in this.
Dr. Tom Ellman, that's all the time we have this morning. Thank you very much for your time this morning.
Okay, thank you very much, Udo.
Good to have you on. Right, 10:30 it is now.